In this video, we're going to cover pregnancy and childbirth. So starting with pregnancy, this is also known as gestation. This is going to average for about 266 days from conception, meaning fertilization of the egg, until childbirth. So this is going to be a little bit different from what is actually measured at the doctor's office. So an actual pregnancy only lasts about 266 days, but when they measure at the doctor's office, they measure from the first day of a female's last menstrual period, which is typically about 2 weeks before conception, before fertilization. So you add another 14 days onto that 266, and what they're measuring at the doctor's office is really about 280 days for the total pregnancy, because those 2 weeks prior to ovulation are going to be included as well in that calculation. And the reason they do that is because everybody's menstrual cycle is a little bit different length from one another, and so this gives them just a better time frame if they look at the first date of your last period versus when your estimated ovulation date is, because that could be different for every woman. So then they break this down into terms or trimesters, and so these terms will last about 3 months apiece, which is why they call them trimesters. So you have a first, second, and third trimester during a pregnancy. So let's take a look at the effects of pregnancy on the female's body, and we'll start with the effects of the integumentary system. We know that the skin will grow in the female to try to accommodate the expansion of your abdomen and the enlargement of the breast during pregnancy. And sometimes that can lead to tearing of certain types of connective tissue in the dermis, which can lead to stretch marks. And it's just going to depend on the female as to how bad these stretch marks are. Some females have more flexible skin, it's a little bit more flexible, and that can prevent stretch marks from occurring as harshly as you might see in other females. You'll also typically have more melanin production in the areolas of the female during pregnancy, which will cause them to darken as well. Now, in terms of the circulatory system, women will gain a lot of extra blood during pregnancy, typically between 1 to 2 liters of blood, and that's because they're having to supply oxygen and nutrients to that growing fetus as well as to their own body, and so they need some extra blood to be able to do that, and that will lead to an increase in body weight as well, and sometimes an increase in swelling and fluid accumulation in the body as well. So this can put some pressure on blood vessels in the pelvis due to the uterus growing, getting larger, and that can result in things like hemorrhoids, varicose veins in the legs especially, and edema or swelling in the feet. As far as the respiratory system goes, breathing will become more labored, especially later on during pregnancy, and that's because of pressure from the growing fetus being put onto the diaphragm from below, and it kind of presses upwards on that diaphragm and prevents it from being able to fully contract to allow for deep breaths. So that can make breathing a little bit more labored. It's also going to cause an increase in urine output during really all 3 trimesters. In the first trimester, you see more urine output in those females because of hormone fluctuations during that first trimester of pregnancy, but as they get farther on and the fetus starts to grow larger and larger, that will compress the bladder, put some pressure on the bladder, and make urination more frequent, especially in that third trimester. Morning sickness can occur within the digestive system. Nausea is a very common symptom during pregnancy, really throughout the entire pregnancy for some women, but especially during that first trimester, and that's typically due to a rise of certain types of hormones. Those hormones can lead to nausea. Hormone fluctuations can lead to nausea or morning sickness in some women. And we know that women will need more nutrients during pregnancy. By the end of the third trimester, they will need around 300 calories per day more than the typical female, because there's higher metabolism going on, higher metabolic rate, which, allows them to be able to provide the nutrients and energy for that growing fetus, and so that's going to stimulate their appetite. The female will also typically need to take supplements for certain types of vitamins and certain types of minerals like iron, vitamin D, and vitamin K. So taking a prenatal vitamin is a good idea, especially ones that include folic acid, because it's been proven that taking extra folic acid during pregnancy can reduce the risk of spina bifida, which is a birth defect that can affect the nervous system of some infants. So now moving into childbirth, we'll talk about Braxton Hicks contractions. These are essentially weak practice contractions that can occur throughout the pregnancy to help stimulate the smooth muscle of the uterus to kind of prepare it for the real contractions, which will happen during labor. Now, labor contractions are going to be much more powerful and much more painful, and these are going to mark the onset of parturition, which is a fancy word for giving birth or childbirth. And so these are going to be stimulated by the release of oxytocin from the hypothalamus of the brain, and as that oxytocin gets released, it will travel to the uterus and will stimulate contractions of the uterus, which will push that fetus downwards onto the cervix. And there are pressure receptors on the cervix that will then respond to that stretch caused by that fetus's head being pushed down on the cervix by sending a stimulus back to the hypothalamus to tell it to release more oxytocin. And so the increase in release of that oxytocin will lead to a stronger second uterine contraction, which will put even more pressure on the cervix, which will send a stronger signal back to the hypothalamus to release even more oxytocin. And so this is kind of a snowball effect. This is a self-amplifying cycle that is caused by a positive feedback mechanism, where we're producing more and more of this oxytocin, which is causing us to have stronger and stronger contractions, which is in turn telling us to produce even more oxytocin, on and on and on again, until eventually those contractions are strong enough to be able to push that baby out of that birth canal. So overall, there are 3 stages of labor. You have the first stage, which is the dilation stage, and this is where the cervix will begin to thin or efface, and it will begin to dilate or open up and widen to about 10 centimeters across, or 10 centimeters in diameter. And at that point, once the female has become fully dilated and effaced, typically the fetal membranes will have ruptured by this point, which will cause amniotic fluid to leave that uterus, and that's what happens when your water breaks, quote unquote, is that amniotic fluid is removed from the body or released from the body. And so this whole stage will take typically between 8 to 24 hours if this is the female's first birth, but it can happen much more quickly during later births if she has subsequent births after the first. Now, the second stage of labor is the expulsion stage, and this is when the fetus is pushed out of the uterus. And so this stage typically lasts about 30 to 60 minutes typically, but this can be much, much quicker in later pregnancies for a lot of women. So typically delivery should happen in the vertex position, which means the head of the baby should come out first, and that's because the head is actually the largest portion of the fetus in diameter, and so this part you want to be able to come out first, because you know if that head can come out, then nothing else will get stuck. If the baby is in a breech position, meaning they're upside down, and the legs or butt tries to come out first, at that point you're going to have some potential problems, because you may be able to get all of these other structures of the body out, but then that head could become stuck in that birth canal, and that could be extremely dangerous. It could end up leading to a stillbirth if that were allowed to happen. So most of the time, if the baby is in a breech position, they will end up performing a C-section to remove it, to prevent any potential, trauma or potential death of the baby. So again, during the dilation stage, this is when the cervix is dilating, opening up, and effacing or thinning out. You also have the rupture of the amniotic membranes and allowing the amniotic fluid to leave the body. Expulsion stage is where the uterine muscle, that smooth muscle, is contracting, that myometrium is contracting to push that baby out in that vertex position, hopefully. And then lastly, we have the placental stage. So once the baby has been expelled from the body, at that point we need to also expel the placenta. So here the placenta will need to detach, those fetal membranes will need to detach as well, and those will need to be pushed out of the uterus as well, thanks to uterine contractions. So if we do not expel all of the placenta and these membranes, that can end up leading to excessive bleeding after childbirth. And so it's important to fully massage the uterus after childbirth to help the female remove the placenta and remove all of those membranes.